Mobile phones and portable devices have permeated everyday life. mHealth appropriates this widely available technology to facilitate the provision of healthcare. mHealth depends on the cooperation between clinicians and engineers, as exemplified by the Smart Health project in India. The Deputy Director of the George Institute, Kazim Rahimi, talked us through this collaboration.
This has been an interdisciplinary project that in this case has been led by clinicians but working closely with engineers and social scientists. Mobile health is the key driver of success of this project. The main motivation for us is the lack of access to cardiovascular management for millions of people in India. One of the major killers of people at younger age are cardiovascular conditions, and we can empower healthcare workers to do the screening and provide them with knowledge to be able to advise people about how to manage the condition, and if needed to be linked them to doctors who will be sitting in more remote areas.
Alongside clinician-led projects, several engineering-based approaches have emerged. Carlos Arteta explains how an mHealth device helps deliver healthcare in developing countries.
For the effective monitoring of hypertension in resource-constrained regions, you need to overcome two main barriers: measuring and monitoring. I would say the key features of the device are that it is low cost and that it is easy to use. It is low cost because it uses a mobile device such as a smartphone or a tablet as its main processing tool, so we take a lot of the cost of a normal blood pressure device out of now this very cheap electronic box. We can rely on the screen of the device to present very clear step-by-step instructions to the user so they can collect very easily, without requiring much training, reliable blood pressure measurements.
mHealth is not solely concerned with developing countries. A group at Oxford University developed an app to help the NHS monitor and manage pregnancy-related diabetes. All of the work presented was developed by students at the IBME, the Institute of Biomedical Engineering. Dr. Clifford, a key researcher in this field, illustrates why the IBME is at the forefront of mHealth.
The competitive advantage that the IBME gives for mHealth is the environment that we sit in here. We have 4 different hospitals that are all within walking distance of us, but we also have very strong connections locally with the Department for Public Health, with the Clinical Trials Unit, and in particular the George Institute for Global Health, who are world leaders in randomized controlled trials in mHealth in developing countries. This hits every single angle of mHealth, right from the device design to the implementation to the user tolerance of the device itself or the system that they're using, and then the evaluation of the efficacy of the system.
As mHealth grows, the IBME is set to play an ever larger role in this field.
The way I view mHealth in future, I think there is no main alternative to that if you want to make healthcare more affordable and more accessible to millions of people worldwide who have currently no or very little access to healthcare. So I'm looking forward to seeing more pragmatic and sustainable solutions using mHealth technologies for managing people with a whole range of conditions.